also what are the main factors that are involved in transmission as well of the diseases. So what are some of those factors that actually are involved in the transmission of those diseases, and also what stages in their natural development do they actually happen. So it is important to be able to look at that. Now, the other thing is looking at what are communicable diseases. Communicable diseases are normally caused by infectious agents. Their transmission to new uninfected people is what causes the communicable diseases. So normally they will come about because there are certain transmission that has been done to uninfected people, and that is what causes communicable diseases. And infectious diseases is also a term used for communicable diseases. So you can either have what you call infectious diseases, or you can also call them communicable diseases. The examples of communicable diseases are mainly malaria and tuberculosis. Examples of non-communicable diseases, because the non-communicable diseases are basically the diseases that are normally not caused by infectious agents. So the examples of communicable diseases are, as I've listed them, heart disease, cancer, and diabetes mellitus. Then I think the other thing that I would also want to be able to address is this concept of endemic diseases and epidemic diseases. So basically, not all communicable diseases that actually affect a particular group, that is a community, region, country, or world of people in the same way over a period of time. Some communicable diseases normally persist in a community at a relatively constant level for a long time. And additionally, the number of individuals that are affected remains approximately the same. So then these communicable diseases are normally known as endemic to a particular group of people. For example, tuberculosis is endemic in the population of African countries. And we also want now to also highlight something else, which is simply what are the factors that are involved in the transmission of communicable diseases. So the transmission of a communicable disease is simply the process in which several events will actually happen one after the other in the form of a chain. So it's a transmission chain where a number of things need to happen one after the other. And this process is known as the chain of transmission, which will normally have about 6 major factors that can actually be identified. Some of those factors, the susceptible host, and then also the issue of the reservoir also, and also the issue of the infectious agent, the issue of the portal of exit, the mode of transmission, portal of entry. Now, the other thing that we also may want to be able to look at is the types of infections that are there. We can classify them as helminths. Those are some of the ones that we can actually be able to see. Again, also we have a type of an infectious agent that we refer to as the protozoa. Then the other one is what we call bacteria. Then the other thing is viruses. Now let's say a few things about these infectious agents. So one, when you're looking at the helminths, when you look at the number of cells, whether they have cells and how many they have. For helminths, they will normally have many cells, and that is why you find that they can even be visible with the naked eye. And good examples of these will be like the Ascaris worm that causes ascariasis, and its length sometimes can be 15 up to 30 centimeters. Now, again, also it's also important to look at the different modes of transmission that are there, that we normally have when it comes to the transmission of when it comes to the transmission of some of these diseases. So one is what we call direct mode of transmission, and then the other one is what we call indirect mode of transmission. In terms of the direct mode of transmission, we actually have either you can transmit diseases through touching. The disease can also be transmitted through sexual intercourse. They can also be transmitted via biting. They can also be transmitted via direct projection of droplets. And also, they can also be transmitted across the placenta. Now, another thing that we have to mention is the whole emphasis about the prevention and the control of communicable diseases. So how do we prevent and how do we control communicable diseases? It is important to make sure that we are able to understand the different ways of classification of communicable diseases. And so following the classification of communicable diseases, then you can be able to apply the approaches of prevention and control of communicable diseases. Now, this also helps in identifying the appropriate measures for prevention and control of communicable diseases that the health extension practitioners and other health workers can actually be able to put in place in the communities. There are two ways of classifying communicable diseases. Clinical classification, which is basically based on the clinical manifestations or symptoms or signs of the disease. Epidemiologic classification. And when you look at the clinical classification, we are saying that this basically includes the following: diarrheal diseases, febrile diseases, and also respiratory diseases. Now, the other thing is when it comes to epidemiological classification, we can also classify diseases in whether they are waterborne diseases, foodborne diseases, that is through the transmission through the ingestion of contaminated food. Then again, also you can have what we call airborne diseases, where the diseases are transmitted through the air. And then we can also have what we call vector-borne diseases, where the diseases are actually transmitted by vectors such as mosquitoes and flies. And this classification knowledge normally helps us in terms of identifying the prevention and control, measures that can actually be applied at each transmission. The other thing is also the prevention measures, that basically refers to the measures that can actually be applied to prevent the occurrence of a disease. Now, the other one is what we call control measures. That simply refers to measures that can actually be applied to prevent transmission after the disease has actually occurred. So when it comes to prevention and control of communicable diseases, there are certain approaches that we use. The first step is always to ask about the main complaints of the patient. Then the other thing is also to ask about the presence of other related symptoms and risk factors. Thirdly, is to be able to examine the patient physically so that we can be able to detect signs of any disease that you suspect. And then finally, it is also good to refer the patient for laboratory examinations if available. And then also the other thing is also screening, that is refers to the detection of an infection in an individual who does not show signs or symptoms of the disease. We can also use the isolation approach, which is basically trying to separate patients from others so as to prevent transmission of the disease to healthy people following detection of an infectious disease. The other one is reporting. So these are common approaches that happen whenever you want to be able to look at the different levels of dealing with the disease.